Okay, my name is Tony, and I'm here to talk about Bell's palsy. Bell's palsy is a condition that is considered to be relatively benign in the sense that it is not lethal, and it often heals on its own, but it can be really a problem for the person experiencing it, and it can take months or years to heal, and it can leave permanent damage in terms of affected facial muscles. You can imagine if it warps your face, affects your speech, affects your ability to close your eyes, for example, it's going to affect your life in a lot of different ways. So it's serious in the sense of the impact it has on a person. As far as for the purposes of this presentation, the big deal is Bell's palsy affects the face, and facial expression and droop is also a big finding in many types of stroke. And in EMS, one of the things we're looking for are strokes and figuring out where to take them and how to treat them. So how do you differentiate the two? Well, looking at the normal face to my left here, you see the woman, and she has the facial nerve coming down, and that seventh facial nerve, it affects the entire side of the face, the upper and lower parts. And if you look, for example, when the Bell's palsy hits, you see that nerve is affected, and it affects the upper and lower sides of the face. So a stroke, on the other hand, it's going to hit an upper motor nerve, and that comes to the lower part of the face, as you can see, leaving the upper part of the head or the forehead basically intact. So coming on to Bell's palsy and differentiating it from a stroke. Well, a stroke, we know, can happen from typically a clot in the brain. It can happen in bad cases to a bleed, and sometimes you can have stroke-like symptoms caused by a mass of some sort, like a tumor or infection in the brain. Bell's palsy, on the other hand, is damage or something affecting the seventh cranial nerve. No one knows exactly why it happens, but it's been associated with blunt trauma. It's been associated with pregnancy and preeclampsia and a number of infections. So the treatment is also pretty nonspecific and basically is beyond the scope of this video. So if you're the medic and you come on scene and you have the complaint of facial droop, how do you tell the difference? Well, again, looking at the Bell's palsy patient to the left, one of the big findings is that you have an entire loss of function or loss of function on one side of the face. So that means the forehead muscles, like you try to make, squinch, like make forehead wrinkling, it won't happen on that left side. The other thing is they can't close that eye. And because they can't close the eye gets really irritated and starts getting really watery. Because the left side of their mouth may be messed up, it could affect their speech and cause some slurring of speech and also drooling. So imagine you went to the dentist and they gave you a super long-acting anesthetic, and now you can't control that side of your mouth. And of course, they talk about the nasolabial fold, which is right here. Well, that kind of flattens out because, again, the muscles that allow you to, for example, wiggle your nose aren't working on that side. On the stroke side, you look back here and you see that the lower face, because it's the cranial nerve, is affected and may be causing that droop that we are all used to seeing. And they can affect the muscles around the eye, but typically the forehead muscles will be able to work in the stroke. And then the other big thing is if you have a stroke affecting one side of the face, it's almost certain you're going to have other signs and symptoms throughout the body. For example, inability or weakness or loss of strength or proprioception in one of the arms and one of the legs or both. So Bell's palsy, again, you can summarize it in that it's basically wiping out the function on one side of the face, and also it's located and localized to the face, and nothing else is going on. Thank you.